Hello guys, welcome to my YouTube channel. I am Denmark Aranas, a postgraduate medical intern, and I basically provide informative videos to medical students. And also, I would like to give aspiring Filipino physicians an idea of what a med student usually tackles in med school. If you find these videos helpful, please don't forget to hit the like button and subscribe to my channel and click the notification bell to be updated for my new videos that I'll be posting every week. For today, I'll be presenting to you the CPC of hypertension, Clinicopathologic correlation. Here, I will explain how the signs and symptoms were manifested by the patient. Hypertension is a very common outpatient department case, and we frequently manage this in the OPD. And it is important for us to have a very well-grounded knowledge about this topic. Shout out to my uh, girl, Eun De Vera, for helping me out in preparing this CPC. We'll be discussing this one by one. Okay, so let's start. Here are the risk factors important for hypertension. First, the family history of hypertension, stroke, and diabetes. Being an elderly, being an obese, and engaging in cigarette smoking. So as for family history of these diseases, it is important to note that hypertension is known to be a polygenic disorder. There is a combination of genes and environmental factors that lead to the development of this disease. And having a family history of hypertension, stroke, and diabetes contributes to an increase in blood pressure in those individuals with that history. Next, the elderly risk factor is also important because among them, they have an impaired RAAS or renin-angiotensin aldosterone system response to a high salt intake, wherein there would be an activation of angiotensin type 1 receptor. And there will now be three effects. The aldosterone will be released, increasing the salt and water retention. Thus, there will be an volume overload. As for the blood vessels, there would be peripheral vasoconstriction, causing now an increased systemic vascular resistance. As for the heart, there will be activation of fibroblasts, causing collagen synthesis and hypertrophy. So there would be an involvement of the heart, which could lead to left ventricular hypertrophy, or it could be asymptomatic. For the heart would adapt to the chronic increase in peripheral resistance. As for obesity, there are three things related to it. First, the increased oxidative stress and inflammation, and the increase in arterial pressure brought about by the increase in sodium intake, causing an activation of neural, endocrine, or paracrine mechanisms, leading to sodium and chloride retention. And pressure natriuresis would occur, thus leading to an increase in arterial pressure. Among obese individuals, there is relative insulin resistance, and with this, there would be a decreased urate clearance. So there would be hyperuricemia and increased uric acid in cells. And aside from that, there's also an increase in free fatty acids. Okay, so that would now lead to an increase in triglycerides and VLDL. And ultimately, it would lead to an increase in blood cholesterol. There would be an increase in the bad cholesterol, the LDL, while a decrease in the good cholesterol, HDL, which would now lead to atherosclerosis, or deposition of cholesterol in the blood vessels because of the dyslipidemia brought about by relative insulin resistance. Now, as for those who are cigarette smoking, there would be peripheral vasoconstriction because cigarette smoking stimulates the sympathetic nervous system and activates the alpha 2 receptors. And peripheral vasoconstriction would also lead to increased systemic vascular resistance. Another important effect of cigarette smoking would be in these things: the impaired endothelial function, arterial stiffness, increased inflammation, aberration of thrombotic factors, and lipid modification, further aggravating the atherosclerosis brought about by obesity. So combining the two, it would lead to the increased systemic vascular resistance. Okay? So combining it all, the volume overload, the vasoconstriction of the blood vessels, the effect in the heart, and the impaired treatment brought about by obesity and increased systemic vascular resistance of cigarette smoking, they would all lead to hypertension. Now I would like to cite my reference, the 20th edition Harrison's Principle of Internal Medicine. I would like to end this presentation by making a shout out to my batchmates. Batch 2020, congratulations to all of us for graduating. I am a proud Emitropian. Let us be the change in this system and culture of bullying and condescension. For we had the perfect vision, 2020, of what kind of doctors we don't want to be. Thank you for listening and have a good day.